Imagine your blood flowing through your body like a highway full of traffic. Sometimes, due to different reasons, the blood can create a sort of roadblock by clumping together and forming a clot. These clots are pretty natural and vital to help your body stop bleeding when you get a cut or an injury. However, sometimes blood clots form inside blood vessels that are not injured or do not dissolve on their own. These clots can block the flow of blood to different parts of the body, such as the brain, heart, lungs, or legs. This can cause serious and dangerous complications such as stroke, heart attack, pulmonary embolism, which is when a blood clot travels to an artery in the lung and blocks it, or deep vein thrombosis, or when a blood clot forms in a deep vein, usually in the leg. So in this video, we will reveal the top 11 warning signs of blood clots that should never be ignored, and at the end, we will talk about how to prevent clots from happening at the first place. So without further ado, let's get started. Number 1. Swelling in one leg or arm. Ever experienced sudden pain or swelling in one leg? That might be your body's way of saying a blood clot could be forming. This is one of the most obvious signs of a blood clot, especially if it occurs suddenly and without any injury. This happens because a blood clot can block the blood flow in a vein, causing fluid to build up in the affected area. The swelling may be accompanied by pain, warmth, or redness. Number 2. Headache or dizziness. Ever had a sudden, splitting headache or felt a bit woozy out of the blue? When a blood clot decides to go on an adventure and ends up in your brain, it can cause some serious symptoms. The brain relies on a smooth, uninterrupted blood flow to function correctly. But when a clot barges in, it can disrupt this flow, triggering a sudden and intense headache or making you feel dizzy. A blood clot in the brain can also cause a stroke, which is another medical emergency. A stroke can cause sudden and severe headache, dizziness, confusion, slurred speech, vision problems, or weakness on one side of the body. If you have these symptoms, see a doctor immediately. Number 3. Chest pain or tightness. Do you have discomfort or pain in your chest that worsens when you breathe deeply or cough? This could signal a blood clot in your lungs, known as a pulmonary embolism. This is a medical emergency that happens when a blood clot travels to the lungs. The clot can block the oxygen supply to the lungs, causing chest pain, shortness of breath, coughing up blood, or fainting. If you have these symptoms, call 911 immediately. Number 4. Leg pain or tenderness. Your veins are the highways for blood, transporting it back to your heart. But when a clot forms in these highways, it's like a traffic jam disrupting the normal flow. When that happens, it can lead to pain or tenderness along the course of the vein, usually in the calf or thigh. The pain may get worse when you walk, stand, or flex your foot. The affected leg may also feel warm or heavy. Number 5. Abdominal pain or bloating. Ever felt sudden, severe pain in your belly without a clear cause? Clots can form in the veins of your abdomen due to various reasons. Conditions like pancreatitis, liver disease, or certain inflammatory disorders can set the stage for these unwelcome clots to happen. A blood clot in the abdomen can cause abdominal pain or bloating, as well as nausea, vomiting, diarrhea, or blood in the stool. The pain may be sharp or dull and may vary in intensity. The abdomen may also feel hard or tender to touch. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 6. Difficulty breathing. As we mentioned earlier, a blood clot in the lungs can cause shortness of breath and other respiratory problems. But sometimes, a blood clot in the heart can also affect your breathing. A blood clot in the heart can also cause a heart attack, which is characterized by chest pain, sweating, nausea, and difficulty breathing. Number 7. Skin changes. Have you noticed an unexpected change in the color or appearance of your skin? When a blood clot affects the blood flow in the veins close to the skin's surface, it can cause changes in your skin's color or temperature near the affected area. The skin may turn blue, purple, red, or pale. It may also feel cold or hot to touch. Number 8. Fever or chills. When a blood clot forms, it sometimes triggers the body's defense mechanisms. In response to the clot or an underlying cause, your body might rev up its internal thermostat, causing inflammation which can trigger fever or chills. You may also experience sweating, fatigue, or loss of appetite. Number 9. Vision changes. When a clot interferes with the blood supply to your eye, it can impact your eye's ability to process images. So it can cause vision changes or loss, such as blurred vision, double vision, flashing lights, floaters, or blind spots. The vision changes may affect one or both eyes. Number 10. Irregular heartbeat or palpitations. Ever felt your heart racing, fluttering, or pounding sensations in your chest out of the blue? Well, these unexpected heart rhythms might be your body's way of warning you of a blood clot. A blood clot in the heart can cause arrhythmia, which is an abnormal heart rhythm. You may feel your heart beating too fast, too slow, or irregularly. You may also feel your heart skipping a beat or pounding in your chest too hard. Number 11. Seizures or convulsions. When a blood clot affects the brain, it can disrupt its normal function, leading to seizures or convulsions, which are sudden and involuntary movements of the muscles. You may lose consciousness, twitch, shake, or foam at the mouth. This is an emergency that needs immediate medical attention. So, these were some of the warning signs of blood clots that should never be ignored. However, keep in mind that not all blood clots cause symptoms, and some symptoms may be caused by other conditions as well. So, it is very important to consult your doctor if you have any concerns about your health and risk factors for blood clots. Now, you may be wondering, how can you prevent blood clots? Well, here are some tips. Number 1. Maintain a healthy weight. Being overweight can increase the pressure in your veins and make you less active, which can raise your risk of blood clots. Try to eat a balanced diet and exercise regularly to keep your weight in check. Number 2. Stay active. Moving your muscles helps keep your blood flowing and prevents it from pooling in your legs. If you sit for a long time, like when you travel or work at a desk, make sure to get up and stretch every 2 to 3 hours. You can also do some simple exercises, like flexing your feet or rotating your ankles, to keep your blood moving. Number 3. Stay hydrated. Drinking enough water helps thin your blood and prevents it from getting sticky and clumpy. Aim for at least 8 glasses of water a day or more if you sweat a lot or live in a hot climate. Number 4. Stop smoking. Smoking damages your blood vessels and makes your blood more likely to clot. It also increases your risk of many other health problems, like heart disease and cancer. If you smoke, quitting is one of the best things you can do for your health. There are many tools and resources to help you quit, like patches, gums, apps, or support groups. Number 5. Watch your sodium level. Eating too much salt can raise your blood pressure and make your blood more prone to clotting. Try to limit your intake of salty foods like chips, canned soups, processed meats, or cheese. Use herbs, spices, lemon juice, or vinegar to add flavor to your food instead of salt. Number 6. Follow your doctor's advice. If you have a medical condition that increases your risk of blood clots, like cancer, surgery, or a broken bone, your doctor may prescribe you some medication or devices to prevent them. These may include blood thinners or drugs that stop your blood from clotting, compression stockings, which are socks that squeeze your legs and improve blood flow, or filters, which are devices that catch blood clots before they reach your lungs. So make sure to follow your doctor's instructions on how to use these safely and effectively. These are some of the ways that you can prevent blood clots and protect yourself from serious complications. Remember, blood clots are not something to ignore. If you notice any of these signs, call your doctor or go to the emergency room right away. Now, we want to hear from you. Did you have some of these signs before? Was it actually a blood clot? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.